The sacroiliac joint is a large joint on the right and left sides of the pelvis. It connects the sacrum to the iliac bone, that's why it's called the sacroiliac joint. The most common causes of SI joint dysfunction are inflammatory arthritis, this is called sacroiliitis, commonly seen in people with ankylosing spondylitis. Hypermobility, especially during pregnancy, after lumbar fusion surgery, and after a pelvic fracture or trauma. When the person has pain originating from the SI joint, they will feel pain on one or both sides of their lower back area, but the pain can also radiate to the hips, groin, and buttocks. Their pain may be increased when they stand up from a sitting position. They may feel numbness in the area too. There are some tests in the physical exam that your doctor will ask you to do and that confirm the origin of the pain is in the SI joint. An X-ray may be ordered to confirm an inflammation of the SI joint. In young males, inflammation of the SI joint can be the first sign of ankylosing spondylitis, a rheumatological inflammatory arthritis that is commonly missed. So, let's talk about exercises for SI joint pain today. Before I continue, let me remind you that this video is not intended to provide medical advice. If you have a condition that causes pain, please talk to your doctor. This video is only for educational purposes. And if there is an emergency, call an ambulance or go to the nearest emergency department. This is the pelvic tilt exercise, which is an exercise to flatten the small of your back, or the lumbar spine, or the lordosis. The lumbar spine has this curvature called lordosis, and some people they have a hyperlordosis, too much of this curvature. And in these people, they can, if this curvature is too much, you can even put the whole arm under the lower back when they're lying flat, lying down like this. That's not good because that will put a lot of pressure on the facet joints. So we need to flatten and relax. How do we do this? Is with this pelvic tilt exercise. So lying down on a mat with your feet flat on the ground, your knees apart the same width as the shoulders. You're going to turn upwards. Try to see if you can feel all of the bones of your lumbar spine touching the ground. If not, I know some people will not be able to do this because they have a big curvature. That's fine. So do this movement of your pelvis going up and down. Like if you do this, backwards and forward. You can also do this on the wall. If you stand against the wall, you can also do this. But on the floor, it's better, it's more efficient. And do this 8 times, and then increase to 12 and to 20 times. So when you're doing this, especially when you are going backwards, that you can feel the bones here relaxing, that's excellent because you'll be putting less pressure on the facet joints. That's the pelvic tilt exercise. The other exercise is the dead bug. So for this one is the same position, lying down on a mat with your feet flat on the ground. We're going to raise our arms and raise our legs. And when you do this, try to adjust the lumbar spine to see if you're touching with your small of the spine here, the lumbar spine, if it's touching the mat. That's the most important thing, that when you do this exercise, try to feel if this area, the lumbar spine, is touching the mat all the time when you do this exercise. So with your hands and arms up, we're going to alternate. So the right arm goes this way and the left leg goes this way and come back. Now the left arm goes back and the right leg goes down. Don't touch the ground, stay here and pay attention when you are doing this movement that your lumbar spine is always touching the ground. If you never did this exercise, you may do only with the legs the first time. You don't need to do with the arms. So straight your legs, don't touch the floor, and bring back, and the other one, and back. And you can do this 10 times and increase to 20 each leg, and then 30. Always the most important thing is to remember, pay attention if the bones of your lumbar spine are touching the ground, they're flat, because if you do this and your lumbar spine goes more curvature, you're not going to help. You're going to make it worse. But if you do this exercise right, it's excellent. The other exercise is the bridges. So for this one, also use a mat. Keep your feet flat on the ground, your knees open apart. You're going to contract your abdominal muscles and your lumbar muscles as you raise from the ground. And when you do this, you're going to feel that you have to contract the glutes and the abdominal to stabilize this position. So what we do here is you're going to press against your heels, the heels on the ground, and then here you have to be flat and straight like this. And now contract your glutes, contract the abdominal muscles, and stay in this position, and lower and up, lower and upper. So keep doing this for maybe 8 repetitions. When you get good at doing this 8, you can increase to 12 repetitions every day, and then you can increase to 20 repetitions every day. So this is good. Always remember, contract the glutes, contract the abdominal, and press your heels against the floor. That's the bridge exercise. This exercise is the bird dog. So the exercise is you're going to alternate. You're going to raise the opposite arm and the opposite leg, and you're going to alternate that position. It's important that you do not curve your spine too much like this or sag like this. So try to keep it straight all the way when you're doing the exercise. So what we do is 1, and when you go here, keep your head low, your arms straight and your legs straight. Bring back here, and now the other side. And 2. And the other side, 2. And 3. Make sure that you are contracting your abdominal muscles when you do this, your glutes. And keep repeating this for maybe 8 times each side. And when this is easy, you can increase to 12 and increase to 20. So this is the bird, and here bird flying, and here the dog. Bird flying and the dog. We're going to do exercises for the gluteal muscles. So there are 3 types of gluteus muscles: the gluteus maximus, medius, and minimus. We're going to combine the exercises and do this for all of them at once. So lying down flat on your back, what I recommend you to do first is bending one leg. You're going to pull the other leg. Don't pull here because you put a lot of strength in your knee, and you don't need to put a lot of force here in the knee. So pulling back here, you're going to pull this knee towards this shoulder, the same side shoulder. And again, take a deep breath and go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And relax. Now the other one, the same thing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Go back slowly. Then the second one, you're going to bring this knee to the opposite side, like pointing to the opposite shoulder. So when you do this, try to bend forward. So you're going to feel the stretch here. And go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And come back slowly. Now to the other side, bring this knee towards this shoulder. You can put your hand here. Take a deep breath. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And the last one here is bringing both together. Bring close to your chest. Take a deep breath. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Pull a little bit. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Remember not to do this. Don't hold your breath and don't do this. Just relax your neck when you're doing these exercises. So now we're going to stretch specifically the piriformis muscle. So this leg straight and this knee on the top of the other one. And we're going to pull the knee to this side. And you're feeling stretching the piriformis is this muscle here. And now you do for the other side. This one straight and this one here. And you pull and you feel stretching. The piriformis is a tiny muscle here, but it's very important and sometimes it's tight and can cause pain that goes down your leg. So you repeat this many times for each side. So for these exercises, we're going to do abduction of the hips with weight bearing when you are standing up. You need a chair that is a sturdy chair that doesn't have wheels, so you're not going to sleep. Or it could be the countertop, or it could be a doorknob. So something for you to hold on. Your body straight, your knees straight, the toes pointing forward, and then you're going to do opening and closing. Knees straight, toes pointing forward. Do this 8 repetitions with the left leg. If this is easy, you can do 12 or 15 or 20 repetitions. So after you do this, then you repeat with the other leg. Just do the same thing. Body upright. Don't bend like this or this. Just stay upright, holding on something here, and just open. Knees straight and toes pointing forward. So for this next exercise, you also need a chair here. We are going for the hip extensors, the gluteus maximus muscles. Let's start with the left leg. You just go like this, keep your body straight, the knee straight, and just move your hip backwards. 8 repetitions, and when 8 becomes easy, you can increase to 12, 15, and 20 repetitions. And then do with the other leg. It's important that you keep your trunk upright and your knee straight. So for this exercise now, we are going to do sit and stand. So get the chair that we were doing the exercise before, and you're going to do a stand and sitting. Try to sit at the edge of the chair, and if you can, just touch the chair and stand completely. Touch the chair and stand. Touch the chair and stand. This is exercise for the quadriceps, for the hamstrings. And when you go down, when you are sitting, try to do very slowly, because then you are strengthening the hamstrings here. And then if this is too hard for you, you can do a complete sit and then go up. A complete sit and then go up. So this exercise we're going to do in the stairs. If you don't have stairs, you can use the steps. Make sure that you have railings so then you don't lose your balance. We are going to do right foot up, right foot down. Right foot up, right foot down. We're going to do this for 1 minute, or you can do this 20 times. Just keep doing this. Keep your body straight. And after you do this 20 times for the right leg, you're going to do this for the left leg. So now we're going to do for the left, left up, left down, left up, left down. And this exercise is on your side, you go up and down on your side. So left up, right down. Just keep doing this. And you do for one side. It's important to do this for the lateral muscles, the ones on the sides of your hips. Once you do this for one side, you can do this for the other side. The same thing. And you feel the muscles here on the side of your hips moving, and your hips moving. So this is important. You can do this 20 times for each side. If you like this video, don't forget to like it here and leave your comments below and share it with your friends using this button here. Goodbye!